Providing a service, such as healthcare or education, is different from industries that provide a product. Success in these sectors requires a relationship and working together toward a shared outcome. At Shift, we call this co-production. This approach is built on the principle that those affected by a system know best the opportunities to improve or redesign it. Shift's approach to improvement is grounded in this principle. Authentic co-production isn't a step along our journey to improvement. It is the ground we walk on. Co-production, when done with equity and intention, prioritizes the voices and experiences of those most adversely affected by a system. This ensures that everyone is served by the improvement efforts. Many organizations want to learn from people facing inequities within their systems, and to do so, need to build cultures that encourage participation and value lived experience. Shift's 5 foundations of authentic co-production are commit, communicate, consult, cultivate, and collaborate. These foundations foster the conditions in which co-production can occur. Outcomes like good health or an education are co-produced. To illustrate this, we are going to draw on an example we experienced in global health to improve HIV care. Even in regions where healthcare capacity is strong, stigma, discrimination, and systemic barriers hinder people living with HIV from accessing high-quality care. Co-production offers an approach to addressing this challenge. For authentic co-production to occur, organizations and networks must commit to partnering with the community and elevating the value of diverse perspectives. This is an opportunity for healthcare providers to identify and understand inequities in care and commit to partnering with patients to improve them. Patient community representatives and members of the HIV care team make a shared commitment to reducing stigma and championing co-production. But the improvement team cannot champion these efforts without support. Administrators and leadership within healthcare facilities must also recognize and commit to supporting these champions with the resources needed to create space for ongoing co-production. Improvement initiatives also need to communicate their commitment with the community. This communication must be multifaceted and inclusive to engage potential partners. It is important that information and opportunities be disseminated in an accessible format that meets people where they are. For example, sharing information via text messages or social media posts in languages spoken by members of the community. However, the Communicate Foundation is not a one-way street. The communication required for improvement involves listening, designing accessible collaboration spaces, and sharing power. It means co-creating a vision of successful partnership that engages new champions. In our example, healthcare facilities share the improvement work that is planned and listened to and learn from patient feedback. The facilities also support the recruitment of people living with HIV to join improvement teams to help inform and implement the plan. Consult means to elevate the voices of those experiencing inequities to co-create priorities. Community members most affected by a system have valuable perspectives to share, and while many organizations seek to listen and build partnerships, they may not be prepared both culturally and logistically to incorporate feedback. Shift has found that empathy is critical to building bridges that facilitate this partnership. You can learn more about empathy in our video, Building a Culture of Empathy and Capacity for Change. In our example, healthcare workers who champion co-production accompany patients through a typical clinic visit to better understand the experience of someone affected by the issue they are hoping to improve. This also uncovers new learning and examines assumptions and harmful biases. To cultivate includes building capacity, developing a shared language and approach, and testing changes with those experiencing inequities. Co-production requires an equal partnership. This means having clear roles and responsibilities and providing the training or resources needed to ensure partners can engage on equal footing. Lived experience must be valued along with professional expertise. Whenever possible, community members should be recognized and compensated for their time, effort, and contributions. Inclusive improvement teams distribute responsibilities and ownership to people throughout the system, regardless of traditional hierarchies. In our example, patients lead workshops, develop change ideas, and work closely with care teams to test them. Working together elevates the value that each person brings to the effort, and the relationships that form break down stigma and build understanding and trust. The Collaborate Foundation is based on sustaining authentic partnerships and distributing leadership in a way that creates equal opportunities for community members to lead. We have found that people are more likely to collaborate and remain in partnership when respectful relationships are formed and when community representatives feel heard and valued. This collaboration within improvement networks creates a space where teams experience the shared transformation that is possible through co-production and invites them to bring that experience to other spaces. In our example, people living with HIV lead efforts that extend beyond the network, advocating with other patients, building voice and power, and bringing additional insights to the work. The foundations of authentic co-production are not linear, but they are mutually reinforcing. Co-production becomes deeper and more authentic as each foundation is strengthened. In summary, people most affected by a system know where opportunities exist to improve or redesign it, and co-producing change with them is critical to achieve equitable outcomes. Investing in these 5 foundational elements creates the conditions for that co-production to occur. To learn more and to download tools and templates, visit our website at shift-results.com. The example of patients and healthcare teams working together to improve HIV care was inspired by our work with the Caribbean Regional Quality Improvement Collaborative and was co-produced with Conrad Mitchell, the founder of Patient Advocate Mission.